Welcome back to the Pain Channel. We hope you have enjoyed what you've seen so far. And on today's episode, we're talking about osteoporosis. Osteoporosis, which literally means porous bones, is a disease of the bones that leads to an increased risk of fracture. In osteoporosis, the bone mineral density is reduced, bone architecture is disrupted, and the amount and variety of proteins in the bone is altered. Now, let's go to Dr. Sywick at the Pain Center of Arizona to find out more about this disease and what treatments they are implementing to manage patients' pain.
Thanks, Rosalie. It's great to be back on another exciting episode of the Pain Channel, and thanks to our viewers for tuning back in. Well, let's talk more about osteoporosis. Osteoporosis is a devastating disease of the bone. More specifically, it's a problem where there is a decreased mineral content of the bones. Oftentimes, that leads to a disruption of the architecture of those bones, and oftentimes there's even an alteration of the proteins in the bones. Putting all of those together, that bone that's affected, or the bones in most cases, become really susceptible for being fragile and, more importantly, for fractures.
Now, Dr. Sywick, which segment of the population is most at risk for osteoporosis?
Well, typically osteoporosis is a disease that affects predominantly senior citizen females. Classically, we'll refer to it as a postmenopausal disease, or after menopause. That segment of the patient population, those females, are certainly more at risk. But make no mistake about it, osteoporosis is not only limited to females. Men can have osteoporosis, and even younger patients, both male and female, can have an osteoporosis problem. Typically, in those cases, it's related to a hormone dysfunction, or in some cases, chronic disease, or even an improper protein in the diet.
And what preventative measures can be taken to decrease the chance of osteoporosis?
Well, Rosalie, osteoporosis is clearly, for the most part, a preventable disease. Osteoporosis can be reduced or almost eliminated with some of the proper modifications in our diet. The appropriate amount of vitamin D, the appropriate amount of calcium, the right amount of exercise in our diet can make significant impacts on preventing this horrible disease. Besides those, decreased alcohol, decreased smoking, decreased caffeine or soda-type beverages in our diet all significantly reduce the ability of this horrible disease to affect your body. But the real big problem is that osteoporosis weakens bones. It makes them much more susceptible to fracture. And in fact, it's that fracture that becomes debilitating for function and issues of chronic pain in these patients that are horribly affected with osteoporosis.
Now, I understand that there are a lot of interesting treatments available at the Pain Center of Arizona for osteoporosis. Can you tell me more about the patient and what we're going to see on today's episode?
Well, Rosalie, today's patient on today's episode, in fact, suffered a horrible fracture secondary to osteoporosis. This patient had a decreased strengthening of bones in her lumbar spine, and in fact, she suffered a fracture of one of those bones. The bones of the lumbar spine are called the vertebrae, and our patient today had a fracture of one of those vertebrae. Because of that fracture, she came to us in severe pain, limited in her ability to walk and bend and twist and turn. This patient had already failed some of the reasonable and conservative therapies of medication management and physical therapy. When those simple things failed, she came to the Pain Center of Arizona, and on today's episode, we'll show you the treatment that she received.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
The special treatment procedure on this episode of the Pain Channel is being done by Dr. Ramon Jones. Dr. Jones is an interventional pain specialist who comes to the Pain Center of Arizona from MD Anderson. He will be performing today a procedure known as vertebroplasty. The goal of today's procedure will be to put some bone cement inside the fracture of the vertebrae that was compromised. Like you see here, our patient has had a compression fracture of one of the vertebrae, one of the bones of the spine. At this level right here, that bone has been compromised. It's at that level that Dr. Jones is doing the procedure today and placing in the bone cement to stabilize this fracture and reduce this patient's pain.
Okay, now let's go to Procedure Suite, where Dr. Jones is going to perform the vertebroplasty procedure.
At the Pain Center of Arizona, we have over 9 locations around the valley. Procedure suites, just like the one you see here, are the focus of the treatments that we do. As you can see, the patient has been placed face down on the table and is now receiving some sedation from one of our board-certified anesthesiologists. At each of our pain centers of Arizona around the Phoenix metropolitan area, we have these procedure suites with specifically the piece of equipment known as a C-arm, or the X-ray equipment that you see here in this room. With the C-arm apparatus that Dr. Jones is looking at, he will be able to specifically localize right down to the fracture site for this patient on the table. Because at the Pain Center of Arizona we have these state-of-the-art procedural suites, we're able to utilize this fluoroscopy machine so that Dr. Jones is now locating specifically the source of the fracture in this patient's spine. At this point, Dr. Jones and his team are preparing the patient's back with some betadine scrub and are now draping the patient. Now that Dr. Jones has numbed up the skin, you see him now placing a needle-type cannula through the skin. This needle will be placed right down inside the bone, right to the source of the fracture. Dr. Jones is looking at the fluoroscopy machine so that he can place the cannula needle directly inside that fractured bone. Dr. Jones can place that needle cannula directly inside that bone. At this point, Dr. Jones and his team begin to mix up the cement. The patient is lying comfortable without any difficulty or complication. The cement in its form right now is simply a liquid. and that's so that Dr. Jones will be able to inject that liquid cement through the cannula tube that he's inserted all the way down through the skin and into that bone that has been fractured. You can see that there's a cannula on the right side and there's a cannula on the left side. Both of these go through the skin and end up at the target site where the fracture is in this patient's lumbar vertebrae. Dr. Jones is now confirming the placement of both of those needles with this X-ray machine. Now Dr. Jones uses the X-ray machine and he's confirming the placement of that cement, being careful to watch that the cement is filling specifically right in the area of the fracture inside the bone. He's careful to watch that none of the cement leaks outside of the fracture in places where he doesn't want the cement to be. Now that Dr. Jones has confirmed with our state-of-the-art X-ray equipment the placement of that cement in the patient's fracture, he will remove both of these cannulas. The patient has completed the procedure without any difficulty or complication. Dr. Jones has removed both of those needle cannula. He's now placing the bandage on this patient, and the patient will be taken to the recovery room to be watched for the next hour or so to assure that they do well before they go home. Now that the procedure is over, the patient's being taken to the recovery room in excellent condition, where they'll be monitored for the next hour or so before they're sent home in a wonderful, comfortable position.
Wow, that's incredible. Now let's go to Dr. Jones for a follow-up on how the procedure went.
Well, the procedure went fairly well. As the patient's the difficulty of doing a vertebroplasty sometimes depends on the patient and the anatomy. If the bone's a little harder, sometimes it's a little more difficult to get in. Her anatomy was pretty good, and we could see the bones fairly well, and the architecture of the bones fairly well. So it was a pretty straightforward and pretty smooth procedure.
Thank you to Dr. Jones for his impressive contribution to help get this patient back into life. With advancements in modern science and technology, our knowledge of many diseases and syndromes is constantly evolving. So, to keep you as up-to-date as possible, we bring you news about osteoporosis straight from the headlines. An increasing amount of studies are indicating that exercise is a key preventative measure against developing osteoporosis. Along with vitamin D and calcium, there is an increasingly prevalent link between certain exercises and increased bone density. According to the studies, bone growth and strength can be triggered by the pull of muscle on the bones. This means that weight-bearing and high-impact exercises such as walking, running, and playing sports could be helpful in curbing osteoporosis. Strength training has also shown to build up skeleton-supporting muscles, thus increasing posture and preventing fracture-inducing falls. Certain osteoporosis medications are now being required by the FDA to issue a warning on their labels. The FDA warns that the bisphosphonate class of osteoporosis drugs may lead to an increased risk of thigh bone fractures. Though there is no proof of the medications causing the rare but serious thigh bone fractures, they were found to be more common among patients taking these medications over a course of 5 years or longer than those not using the medication. The FDA will continue to investigate, though they stress that bisphosphonates have been shown to significantly reduce the overall risk of bone fractures from osteoporosis. And finally, we go to ancient Egypt, where old news about osteoporosis may be contributing to new knowledge of cancer. A new study performed on Egyptian mummies by the University of Manchester has determined that cancer was extremely rare in ancient Egypt. After investigating hundreds of mummies, they found only one case of cancer. Previous studies had found that osteoporosis and similar diseases were relevant in ancient Egypt. The researchers determined that the findings show that cancer is a man-made disease, though this theory is still widely contested among the medical community.
Well, Rosalie, in upcoming episodes, we're going to be talking about more chronic pain syndromes, and more specifically, more treatments that we offer at the Pain Center of Arizona. We're going to be talking about abdominal pain and pelvic pain, headaches, migraines, a difficult nerve disease called reflex sympathetic dystrophy or complex regional pain syndrome. We're going to be talking about medication managements and physical therapies and other different types of injection therapies that we offer at the Pain Center of Arizona. We look forward to you joining us on upcoming episode. Thanks again, Rosalie. And remember, at the Pain Center of Arizona, we're here to get you back into life.
Well, that's all for today's show. Join us next week when we discuss chronic regional pain syndrome and RSD. We'll also be debuting a new segment where you can ask Dr. Sywick for medical advice. So make sure to visit painchannel.tv to email the doctor your questions. We'd like to thank everyone who contributed to today's show. I'm Rosalie Michaels, and I'll see you next Wednesday at 3 p.m. on the Pain Channel.